My dear parishioners, health is wealth is a quote that we've been hearing since ages. But the true importance behind it has never been more truer than last year. Never before have we prioritized our health before this. Today, as we are facing the most challenging times of our lives, our only hope is to ensure that we are safe by taking care of ourselves and above all, our health. As we venture into the new normal post-COVID, there needs to be a shift not only in our health but also on our overall lifestyle patterns. So I, Elena D'Souza, brings to you a talk show on physical health. Before introducing our guest for today, I would like to call upon none other than our parish priest, Father Felix, to address and kickstart the health series talk for this week.
My dear friends, during the pandemic, what are the news items that catch our attention? What are the images uppermost in our mind? Sad to say, it's about someone searching for a bed in the hospital, someone scrambling to get an oxygen, someone pleading for a medical care, someone rushing for a vaccine. And in all these searches, they do not meet with much success. And therefore, it becomes important at the parish level to tell our own about the health care. While we cannot have control over certain things that are the administration of the state or the hospital, but there are certain things we can be in control of. If there is one thing we notice about this coronavirus, it beats or defeats any logic. Those who are at home still get it. Those have taken precautions have got it. Those have got vaccine have also succumbed to it. It defeats every logic. And therefore, certain basic things are needed to be done by each one. And then we can leave the rest to God. What about breathing, exercises, alternate forms of medicine, certain things told to us by the wisdom of our grandparents, the whole positivity that we need to have and not give up in situation. We have today Dr. Fiona Miranda, physiotherapist, who believes that the little care that you can take will go a long way in helping you not to succumb to this viral attack. While we do the little that we can do, as per the advice of Dr. Fiona, we also keep in mind that the rest of the people are suffering and that our example may give others the light how to keep up to the appropriate behavior so that combined we can defeat the onslaught of this virus. We have Dr. Fiona Miranda advising us. Our parishioner, God bless you, Dr. Fiona.
Thank you so much, Father, for addressing us. Today, I'm going to be in conversation with Dr. Fiona Miranda. Our guest today excels in providing post-COVID care. Specialized in musculoskeletal and sports, she's a physiotherapist by profession and holds 8 years of experience in her field. Currently, she is the head of the COVID department at Neuron Hospital and is also affiliated with other hospitals. It is my pleasure and absolute honor to welcome Dr. Fiona here with us today. Hello, Dr. Fiona. It's so good to have you on our show today.
Thank you for having me.
First of all, congratulations on your book.
Thank you so
And
much.
secondly, thank you so much for everything that you've been doing. Last year has been a chaotic mess, and we as citizens are privileged to be in comfort because you have decided to be in discomfort. So thank you. And yes, I won't keep you nor our viewers waiting. So let's just get started. So we are all pretty much aware about the basic symptoms of COVID, but we are hearing news of the new variants and of the second and the third wave coming in. So I just want to ask you, what are the overall symptoms that we need to take care of?
So the symptoms remain the same, be it fever, be it dry cough, be it the productive cough, be it loss of appetite, loss of smell. There have been cases wherein you see people having loose motions.
Right.
But specifically in children, the symptoms that we mainly see is sore eyes.
Okay.
So that shouldn't be ignored because normally people think COVID is all about fever and
Right.
cold. So that is also one of the symptoms that we need to look out for,
Right.
especially in children because children are mainly being affected in the second
Right.
wave. So they need to be taken extra care of. So this are the symptoms. Yeah.
Okay. Also, I've noticed very recently that a lot of people experience symptoms but are not tested positive, and a lot of people are tested positive but are not, having any symptoms. So what do you have to say about that?
Well, to be honest, there are many factors related to it. Depends, if you're taking the test in the initial stage, very high chances of you coming out negative, being
Okay.
tested negative. And so that is it. But what I would say is that those who have been tested positive, they are having COVID. Those who are negative
Right.
doesn't mean that they're negative. It could still mean positive. So in short, the only way you can understand is by having fever, cold and cough, because most of the people think that they have these symptoms in a year once, but no,
Right.
this is the pandemic and people need to realize that fever, cold, cough, a very high chance for it to being COVID.
Right.
So it shouldn't be ignored.
Right. So at the end of the day, just be safe, guys. Also, I just want to ask you, since we're again in a state of lockdown, what are some of your self-care tips that one should adopt?
I think apart from the fact that you are supposed to wear your mask, and when I say wear your mask, I see many people not wearing the mask properly.
Right.
This needs to be compact because this is where the virus comes from. So even if you're going to put your mask little lower, it makes no sense. So
Right.
this is one tip, is that use your mask properly.
Right.
And of course there's social distancing also, which is very important. But the most important tip what I would suggest is to stay active. And when I say active, I do not mean regular workouts and go out jogging and all. All I mean is keep yourself active, be mobile.
Right.
You have to be moving about. That's all I mean. It doesn't mean all I mean to say is that don't have a sedentary lifestyle where I'm just going to sleep. No, you have to be active. You need to keep your muscles active, your bones active, because the more active you are, it does help in your immunity as well.
Right.
So that is how important being active is.
So I like the fact that you brought the topic out very soon. If I have to ask you, how important is physical exercise, in this time? Is there some particular exercises that you recommend that, might help boost your immunity faster or better?
Yeah, what I would suggest and what recent advances have suggested is that in this process of being, having the virus, it is suggested that each day you are losing around 2% of your muscle mass, which means in this 14 days period, each day you are losing your strength by 2%. So you have to be active, you have to exercise to rebuild that strength
Right.
again. Okay, this is one factor, is to get back your strength again. Also exercises help with your immunity. Moreover, during this pandemic, many people have been depressed. So exercises helps you by being a stress buster, lifting up your mood.
Right.
So this is how important exercise is specifically in this pandemic.
Right. So I heard a lot of people, debating between physiotherapy is better or yoga is better. So since you're experienced, I want to ask what is your take between the two? Is one more important than the other? Is both needed? What is the...
To be honest, yoga is more about flexibility. It would be wrong to say that physiotherapy is more superior, given the fact that we know the human body, how it works.
Right.
But I have personally seen many patients doing well after being COVID positive, just because they were doing yoga before,
Right.
because they were active. So again, the bottom line is the same. You have to be active. So it doesn't matter if you're doing physiotherapy or you're doing yoga.
Yeah.
We just want you to be active. Of course, if you are having COVID, as I said, each day you're losing the muscle strength.
Right.
So then you need a little vigorous training, because then yoga alone will not help you.
Right.
You need to build your strength, so that's going to take a little more hard work than just yoga.
And I feel like regardless if you get COVID or not, just be active.
Yes, be active, very important. Even if when this pandemic gets over,
Right.
very soon it will.
Yeah,
So
hopefully.
that's when also I suggest that you have to be active irrespective.
Right. So recently, I've been getting a lot of WhatsApp messages and a lot of pictures where people are demonstrating a lot of breathing exercises. Of course, physical has its own part, but a lot of breathing exercises, and all seem relevant and all seem helpful. But I can't miss out a chance, because you're so experienced. I want to ask you, is there particular breathing exercises that one needs to do to have a better lung capacity?
Okay, given the fact that people have specialized already in the breathing exercises,
Right.
I just want to add 3 tips when it comes to breathing exercises. There are just 3 things you need to know. First of all is breathe in from your nose and breathe out from your mouth. Reason being, when you blow out from your mouth, you are exhaling more carbon dioxide, that's the dirty gas inside.
Right.
When you breathe out from your nose, you do not get to expire that long, but when you breathe out from your mouth, the expiration is always longer. So we need to get rid of the carbon dioxide that's got accumulated.
Right.
So that's the first point. The second point is when you inhale from your nose, you inhale to the maximum and you hold that position. Okay, and then you blow out. The reason being, in COVID, the lungs get all tightened up. We call it fibrosis in medical term. So we need to train the lungs again to expand and relax, so that you are able to take in more oxygen inside. That is the second thing you need to know. And the third thing is that your expiration should always be longer than your inspiration. If you are inhaling for 2 seconds, you have to exhale for 3 seconds. So that's how.
Okay.
So these are the only 3 things. Apart from that, you all can continue the breathing exercise that you all want, however you all want it.
I feel like I've heard all of this in my PT lecture, but I just didn't pay attention. So yeah, no, but also I read in your book something very interesting called as huffing. Do you want to also tell people what huffing exactly is?
Huffing is basically more or less like coughing, but when you cough, you are really, like especially those who've got a very productive cough in COVID, they tend to cough a lot. So that puts a lot of pressure on your chest.
Right.
And you are doing it to remove the secretions outside. So huffing is nothing but it's like you standing in front of a mirror and then you create the vapor, and that is all huffing. So in short, the only difference between them both is that huffing is less strenuous than coughing. So it will not put that much of pressure on your chest, what coughing will. So that is ultimately the goal, is to remove the secretion, because we do not want the secretions to stay inside, because if the secretions stay inside, that's when your oxygen starts dropping.
There's also one other question. This is a personal question, sometimes people say that you need to dedicate like an hour only for breathing, and a lot of other people say that you need to do it in intervals. What do you think is the right approach to it?
I think breathing exercise is not just about increasing the oxygen in your body. If you notice, when you do breathing exercise, it really soothes your mind as well.
Right.
So half an hour wouldn't be a wrong statement, because if you are doing it for half an hour, but at the same time, what I would suggest is, like, if you feel that your muscles are tired, your body is tired, so then you reduce the time. Do not push your body to do anything, because it is a sign that your body is giving you. So respect that sign. Do not go overboard with it. So in short, the time doesn't matter. Understand the signs that your body gives you. You can exercise, you can breathe, you can do the breathing exercise every 2 hours, but provided your body is supporting you, you are not getting tired.
So I feel like to each of his own, just
each
understand
of
what your
his
body
own.
wants.
Yes, just understand what your body wants.
Okay. So now, we are at this stage where, we're in another lockdown period. And a lot of people need supplements for, just to keep their body going. But since we are in a lockdown, we can't go out that often. Do you have any like these small Indian household nuskas that we can, fall back on?
Vitamin C, everybody knows by now, everybody knows that vitamin C is an immunity booster. So again, you have your vitamin C food like your lemons, your oranges, and of course turmeric milk also helps, that helps with your immunity.
Right.
But also if you're coming about immunity, the whole point about having a supplement is to get that extra immunity, right? So let me just tell you that exercise also increases your immunity. It's, in short, it's not just about diet.
Right.
It is also about being active, because that also boosts your immunity.
Right, right.
So that is how I say, of course you do need the supplements, given the fact that Indian cooking is not that healthy. There are a lot of spices, there is overcooking. So I cannot say that Indian cooking will give you the nutrition that you need. So since with this kind of food you do need that extra boost, unfortunately. But
Right.
yes, of course, lemon really helps. So if you're going to have anything in the raw form, you will get that content. So that is how it helps.
Yeah. So since we're talking about, like food intakes and stuff like that, what according to you is a good diet? Like, what is the most recommended food that, people in this time should have and should consume?
I think people at this point of time specifically should have a very balanced diet. I cannot say avoid fats or avoid sugar or avoid carbs. I think everything has got its own role, so you should have more. But then again, I would suggest have a lot of fruits.
Right.
Okay, have fruits, have vegetables, because these are in the raw form, so you're getting more of the nutrition.
Correct.
Than compared to our Indian cooking again.
Right, right.
So I would say a good diet is a balanced diet which has everything in a good quantity. There shouldn't be too much of anything. I cannot just say you have a lot of salad and eat less food. No,
Correct.
it needs to be, everything needs to be,
Right.
in a proper proportion.
Right. My mom will be very happy hearing this, and I think my diet is going to change from tomorrow. Soon. Yeah. So I want to ask you, what are the changes that a person experiences post-COVID?
Okay, post-COVID, you experience a lot of changes, and with changes I mean physical changes, mental changes and emotional changes. Physical changes being like you feel tired very frequently.
Right.
That is because, as I said before, each day of this 14 days process of being COVID, you are losing around 2% of your muscle mass. So obviously you will be more tired.
Right.
So that is your physical part. Mental part is, you tend to get worried a lot. So you are more stressed. So that does see, if you are going to be frequently tired, not able to cope up with your basic
Right.
activities also,
Right.
it is definitely going to affect you mentally as well as emotionally.
Correct.
So these are the changes that we see post-COVID. That's the reason we specifically, and we encourage people to exercise, because when you exercise, you build up your strength. Along with that, your mood gets uplifted.
Right.
Because that is what exercise does to you. It boosts your immunity, it boosts your self-confidence, it boosts your strength. So that is how important exercise is post-COVID also.
Okay. When we're talking about post-COVID, like all of these changes, a lot of people recover and they have to go back to work for whatever reasons, What is that? Is there a specific period that a person needs to keep in mind? Like, I need to rest for a certain time and then resume work? Or is it different for different people?
So doctors say that, once you have completed 14 days of your COVID period,
Right.
you are ready to resume work, you are ready to go out. But when you go to work, you need to be physically as well as mentally fit enough. Now when as I said, post COVID you tend to get tired more frequently. So I would suggest is that take a break, exercise, build up your strength, and then balance yourself out, and after that resume work. Like resume work when you know that your body and your mind is fit enough, and that is something only you can judge. No doctor or anybody can tell you, you are now capable of going to work. That is something only you can judge for yourself.
Right.
So I would suggest post COVID, take a break, build up your strength, be emotionally, mentally stable, and that's when you should resume work.
Right. So just a negative test does not do it.
No, just a negative doesn't do
Yeah.
it, because even after COVID, though you have though your test shows negative, but the damage is done done to a certain extent. So that needs to be reversed. So that will come with proper medications, with a good lifestyle modification, with good diet, with exercises, then you can come back to what you were. So that will take time. Now how much time that will take, this nobody knows. As again I tell you, you need to judge it by yourself. You need to understand what signs your body is giving you, and that's when you should know that okay, I am confident enough to resume work. That's when you go to work.
Right. Yeah, I think everyone needs to pay close attention to this, because a lot of people think that, you know, just because I'm tested negative, I can just be normal.
Yes.
There are a lot of other issues that...
Because if you go and you are not able to perform, you will be frustrated because you are not giving your best, you know. So it will impact your work. So that is the reason you waited this long, so might as well wait another 1 week, 10 days and then resume work.
Right.
Because then people are not that scared also of you anymore. So so that's why I would suggest that take a break another 1 week, 10 days and then resume work.
Right, perfect. So I hope you all are listening. Also, you always, you know, put importance, like you've always, you know, said that exercise is very important.
Right.
And especially in your booklet, you've mentioned, you know, you've given a perfect segment for that.
Right.
So something like shoulder press, shoulder strengthening, there's tricep dips and stuff like that. I want to ask you, are these specifically for people who have recovered from COVID, or is it okay for everyone to do it? Like,
I would suggest that this is basically called mobility exercises, and this is something I think everybody should do irrespective to whether you have been infected or no. But the difference comes when you have been infected with COVID, you do this mobility exercise along with a lot of breathing exercise, because most of the patients are been on oxygen. So your body is little low on oxygen right now. So post COVID you need to do breathing exercise along with your mobility exercises, and for people who have not been infected, for your mobility exercises will do it.
yeah, okay, I think that, that answers the question. Thank you. Okay, so we've spoken about, you know, breathing exercises and physical exercises and diet intake and everything. But apart from these, you know, what are the other lifestyle modifications that one needs to adapt to?
Apart from the fact that you are supposed to be active and follow social distancing and use your mask appropriately, one needs to have a good resting period of around 7 to 8 hours, 7 hours minimum.
Right.
Okay, 8 hours maximum, at least this should be, because sleeping is very important, because whatever recovery happens in your body, it is happening during your sleeping period. So if you are going to deprive your body of that recovery phase, then how will you ever recover? So sleeping is very important. Apart from that, hydration, it's very important to be hydrated. I would suggest around 7 to 9 glasses of water every day. I also want to specify that yes, I know people are big fans of Kada, but let me just say that there are many cases that have been coming wherein people who have too much of Kada tend to have a little kidney problem. So I want to make this very clear that 2 glasses of Kada in a day is more than enough. Okay, even warm water, okay, 2 to 3 glasses in a day will just do it. You do not need to go overboard with anything, be it your diet, be it your sleep, be it your water, anything. Do not go overboard. So these are the only modifications, and also we need to you know, be aware of symptoms, because most of the, again I am specifying on this, that you have any symptoms, okay, and you remove the test and the test comes and you test yourself and your test comes negative, that does not mean that you do not have COVID. Maybe you have not reached that stage yet, maybe you are almost on the verge of reaching. So still continue all your precautions.
Right.
That is what, like, there should be, you need to be a little disciplined at this point of time.
Right. I think among the youth, sleep is not an issue, but water definitely is.
Yes, definitely. A diet is, it is, because youth are mainly, you know, lovers for junk food. Right. So I think it is high time now that they should be eating healthy food, because that is all that's going to help with your recovery. And moreover, this second wave is mainly affecting the younger crowd. So younger crowd needs to be even more careful and cautious. So therefore,
But of course, you know, since we are talking about youth, we also have a range of like middle-aged people who have these certain kind of instruments, and they're kind of, I think, I'm borderline obsessed with them. You know, they have tons of instruments, they want to check constantly their stress level, their BP level, their sugar level.
Right.
So what are the instruments that one needs at home, and what are the others that, you know, we're just following some kind of fad and, you know, just keeping it
So
at home?
I think during this pandemic, a thermometer would do, and a pulse oximeter, that is to check your saturation. Okay, now saturation, not everybody knows this, but it needs to be checked in your middle finger,
Okay.
not in your index finger, because apparently according to research, this is a better place to monitor your oxygen saturation. A pulse oximeter is what we call it. It's available in the chemist.
Okay.
It shows upon your oxygen level as well as your heart rate.
Okay.
Okay, so a pulse oximeter and a thermometer would do it. I mean, it will definitely help. So these two instruments is necessary, I think, at this point of time.
Yeah, other everything is
No,
not
I mean,
that.
you can have the other one, but this two specifically needs to be at this point of time in every household.
Okay, perfect. Yeah.
Yeah.
But also, you know, since you're working on the, you know, on the job, how do you feel the situation is right now? Do you think that it's fine, it's better, or it's getting worse and there's more to come?
Right now, I think giving the lockdown, we have been seeing that the cases have reduced, but these cases have been reduced only in Bombay, maybe because of the better health infrastructure. Okay, maybe we have got better facilities, but overall the cases are increasing in India.
Right.
But in Bombay, the cases are definitely reducing.
Right.
The symptoms are, people are becoming more aware. It could be because of the health infrastructure, or it could be just because of the lockdown. So people still need to, you know, continue all the precautions that they take.
Right.
Maybe the cases are just reducing because of the lockdown. So therefore, people need to be careful.
Right. I personally think it is because of vaccinations, but having said that, a lot of people have this kind of fear that, you know, vaccines are not good for us and stuff like that. What is your take, or what do you have to tell all of them about?
I think vaccination is a must. Everybody who can take, who have been allotted and who definitely have the privilege should definitely take the vaccine. Yes, there are news wherein there are side effects, of course, but that is in a very rare population. That is just the risk that you have to take, because even if you do not take the vaccine, you're still at a risk.
Right.
So might as well take the vaccine and, you know, be safe, because as a health professional, we have also taken a vaccine, and in a day we see so many COVID patients, and till now it has worked good for us. So I would definitely say people need to take their vaccines.
Right.
But again, vaccine doesn't mean that you're 100% safe. It could simply mean that though you have the antibodies and you are safer, but you can still infect the others.
Right.
So it's not like vaccine is the ultimate solution as of now, because you can still be a carrier.
Right.
So you still need to take your precautions even if you have been vaccinated,
yes.
but definitely go for the vaccination.
Right. So just wear a mask, sanitize, and just be safe at the end of the day,
Yes.
regardless of anything.
Right,
Yeah.
right.
But also, are there any specific precautions that people need to take after having taken the vaccination?
Yes, you still need to wear your mask, you still need to follow social distancing as well, because as I said, you could still be a carrier. You have the antibodies in yourself, so you are to a
Right.
limit safe, but you still have the virus in you, so you could infect another one. So having a vaccination, you still have to follow the precautions.
Right. Perfect. Okay. So we've covered everything, you know, relating to COVID. So thank you so
Yes,
much.
welcome.
I'm sure that I'm more smarter now before I entered. So thank you. Do you have any final thoughts that you want to tell the viewers? Closing remarks?
Okay, I've already covered most of it, but I'm just going to repeat it again. Wear your mask properly. It shouldn't be down, it should be kept at the place it's supposed to be kept. And social distancing again. Stay active and be hydrated and eat healthy and avoid crowded places and be in a good ventilated area and just be calm. Okay, we will get through this, and do not panic. That's it, that's all. I have mentioned everything in my book for everybody. This book is not just for those who have recovered from COVID. This book is a knowledge for everybody, whoever has been or not been affected with COVID. It gives a view about everything. It's not just about diet and exercise, it's about when can you resume work, it's about your appearance, your mood, your relationships. It's about everything. And apart from this, if you still have any queries, you can always contact me. There's my contact number as well over here. Okay, so that's all I'm going to leave you all with. Just stay healthy and stay fit. That's it.
Thank you so much. I hope that everyone makes the most out of this initiative. And once again, thank you so much, Dr.
You're
Fiona.
welcome.
Thank you.
Thank you.
Thank you so much for your initiative, Dr. Fiona. This book will be available in the parish office, so please do come and collect a copy for yourselves. And now, we come to the end of today's session. As you must have heard in our conversation earlier, the only way to truly transition and overcome the effects of this pandemic is to modify your own lifestyle patterns. So, keep your mind and body active and stress-free. And at all times, be safe and ensure everyone around you is also safe. I would also like to place my gratitude to all frontline and essential workers for being the pillars of our society and helping us to curb and put an end to this pandemic. I'd like to take this moment to thank our parish priest, Father Felix, every single person involved in making this event happen, and lastly, to all of you, our viewers, for joining us today. Do not forget to tune in tomorrow at 7:30 p.m. for another important talk by Dr. Angelica D'Souza on the topic mental health. Until then, stay safe, take care, bye.